This summer, Dr. Peter Allen became chair of the Duke Department of Surgery, succeeding Dr. Alan Kirk, who stepped down after more than a decade of service. Dr. Allen joined Duke in 2018 as the chief of the Division of Surgical Oncology, and he brings exceptional experience and a collaborative spirit to his new role. Today, I'm pleased to be joined by Dr. Allen to talk about his vision for the future of surgery at Duke. Peter, thanks for joining me today, but most importantly, thanks for taking on this new leadership role. So you're now a couple of weeks into being chair of, I would argue, one of the best surgical programs in the country. What's so unique about the Duke program?
Well, thank you very much, and it's a great honor to lead the department in this way, in that it has an incredibly strong legacy.
Yes, it does.
Duke Surgery is recognized nationally and internationally as just a great program.
Mm-hmm.
And I think, if you ask why is it, I think it's really that they paid attention to all three missions, that the clinical, academic, and research missions of an academic department have been focused on and developed. Clearly, the research mission is phenomenal, ranked number one in NIH funding over the past 4 years under Alan Kirk's leadership. They've always been known as a very clinically innovative and talented group, and for me, it's a real honor to be able to work with them. Our cardiac group doing first-in-human transplants on young babies that are having phenomenal success. And then even in the education space, that our residents compete for the best fellowships in the country and have been very successful. And we're standing in the SEAL lab, right? It is our laboratory where we actually study how to train future surgeons. So I do think it has been that focus, not just on one area in academic surgery, but really focusing on all three.
So, extraordinary history. How do you build on that success?
Yeah, and that perhaps might be one of the biggest challenges of taking on this role, right? Lou Holtz, the longtime coach of Notre Dame, the football team, always said never become the coach of an undefeated team. We're not undefeated, but the department's doing really well. Given the climate, the climate where we're talking a lot about headwinds these days, I think we're going to have to focus, really focus what we're doing and invest in really what we feel are our strategic priorities.
So Peter, I know in some of our conversations you talked about non-negotiables.
Yeah.
What are they?
Do you watch The Bear?
I love The Bear.
Okay, so The Bear, he has his non-negotiables, right? And so I've thought about this a lot. Like, I think we all should have some non-negotiables that in our place of work that we hold as sacrosanct, that we can't not use these as our guides to success in creating excellence and a culture of excellence. So I shared at least one of those with our faculty last week, where I talked about, for me, number one is that the patient comes first, period. And in everything we do, the patient has to come first. And that's obvious in our direct interactions with the patient, but also as we're designing these research efforts and the academic pursuits that we have here, we always need to think that despite all the headwinds that we have, that our patients are our primary focus. And for me, that's number one. There are many others. The other that I shared with the faculty was also around just culture and creating a culture of excellence, and one where we treat each other with grace, which is a word that Anna Aquari uses frequently, where we create an environment where we treat everyone with the respect and courteousness and dignity that they deserve. And so to me, sort of listing out those non-negotiables. And I think if everyone does that, they can then better clarify how they want to proceed daily at work.
And I bet that was well received, the faculty.
Yeah, I think so. And I think the department, both of those things, first of all, the patient comes first. Absolutely, the department lives that value. And also the culture. People want to work at a place that where they feel valued and where they feel that they have a real role and part of that mission. So I do think the faculty were very much on board with both of those.
I am so excited about your leadership, and I'm sure you're going to take a great department and lead it into the future. So thank you.
Well, thank you.